Good afternoon, everyone. To commemorate the World No Tobacco Day, and this year's theme, Commit to Quit, my colleagues Dr. Jane Ongango, Dr. Geoffrey T. Fong, and I are pleased to present findings of surveys of Kenyan tobacco users and non-users conducted by the International Tobacco Control Policy Evaluation Project, called the ITC project. Dr. Ngango and I are co-principal investigators of the ITC project in Kenya. Our presentation will focus on sharing findings about smoking cessation and differences between Kenyan smokers and smokeless users, and Kenya's support for future policies. Dr. Geoffrey T. Fong, founder and principal investigator of the overall ITC project, will present data showing how Kenya's survey findings compare with more than 25 other ITC countries. We would like to extend our sincere thanks to the Minister of Health and in particular to Mrs. Anne Kendagor for providing this opportunity to present our research findings. There are three main objectives of the ITC Kenya survey. First, the survey aims to examine patterns of tobacco use in Kenya. Second, the survey aims to measure the impact of tobacco control policies and programs in Kenya. Thirdly, the survey aims to provide evidence-based recommendations for ways to strengthen tobacco control policies in Kenya. To give you some background on the ITC Kenya survey, it's a nationally representative cohort survey of adult users and non-users. The survey is conducted face-to-face by trained interviewers. The survey respondents were mapped from 8 provinces in Kenya, with 2 to 5 districts covered per province. We have conducted 2 survey waves so far. The wave 1 survey was conducted from October to December 2012 among 1,370 tobacco users and 559 users. In April to June 2018, the Wave 1 respondents were recontacted to complete the Wave 2 survey. We were able to retain 45% of the Wave 1 survey respondents and added new respondents to maintain a cohort size of 1,078 tobacco users and 582 non-users. To commemorate the World Day, No Day Tobacco Day, the Ministry of Health has released a report on the findings of ITC Kenya Wave 1 and Wave 2 surveys in a comprehensive 81-page national report. The report can be downloaded from the ITC project website at that particular address. As I mentioned earlier, our presentation today will highlight some of the key findings with a focus on cessation, which is the World WHO theme for this year's World No Tobacco Day. But you can download the report to take a look at the findings across the FCTC policies. The percentage of tobacco users who were smokers and smokeless users and mixed users at Wave 2 by gender. The slide provides a breakdown of the types of tobacco users among the Wave 2 sample. The majority of the respondents, 72%, was cigarette smokers, and just over a quarter were smokeless tobacco users, such as oral snuff, nasal snuff, and Cuba. Only 2% of the sample smoked cigarettes and used smokeless tobacco. There are male and female differences in the type of tobacco used. 79% of male tobacco users primarily smoked cigarettes, while the majority of the female users, 67, use smokeless products. The ICT intention to quit among users and smokeless users wave 2. The results I've just shown you in the slide. The ICT research from other countries has shown that intent to quit smoking are an important predictor of future quit attempts, as well as success in quitting. The ITC Kenya survey asked smokers and smokeless users whether they plan to quit smoking in the next month, or the next 6 months, or sometime in future, or not at all. Only 16% of smokers and 13% of smokeless users said they plan to quit in the next month or the next 6 months. 45% of the smokers and 37% of the smokeless users said they plan to quit sometime in the future. It is concerning that about 2 in 5 smokers and a half of the smokeless users say they have no plans to quit smoking or using or smokeless tobacco. We found a large variation in the percentage of smokers who plan to quit smoking across the 8 provinces. For example, the percentage of smokers who say they plan to quit in the next month or 6 months range from only 4% in Nyanza to 25% in Central Province. There are high rates of smokers who have no plan to quit in the Northeastern Province at 76 and Nairobi Province at 61, and compared to only 22% who have plans to quit in Nyanza. Now I would like to turn the presentation over to Dr. Jane Ongango of the Kenya Medical Research Institute. Thank you. Jane, take over.
Thanks, Dr. Kamari, Ann, and Ministry of Health for this opportunity. My slides will focus on what ITC Kenya data showed on the effectiveness of tobacco control policies. In September 2016, Kenya implemented 3 out of 15 of the new pictorial health warnings. This replaced the text-only pictorial health warnings implemented in 2008. There was no change in the size of the warning, which covers 30% of the front and 50% of the back of the pack. We asked respondents a set of 7 questions before and after the implementation of the new warnings to measure their impact. The graph on the right side of the slide demonstrates an increase in change in 6 out of the 7 indicators of warning label effectiveness. Noticing of warnings increased from 64 to 72%. Reading warnings increased from 30% to 41%. Thinking about health risks increased from 28% to 43%. A smoker was a lot more likely to quit because of the warnings. This increased from 24% to 38%. And smokers could avoid the health warnings. This increased from 12% to 32%. This is an important indicator because studies have shown that avoidance of warnings has a positive impact on quit attempts. And finally, those who forego a cigarette because of reading the warning increased from 19% to 26%. Although the ITC Kenya data shows that the switch from text to pictorial warnings increased the impact of the warnings, there is room for improvement. Article 11 of the FCTC called for a minimum warning label size of at least 50% of the top, front, and back of the pack. Research has shown that large pictorial health warnings reduce tobacco consumption, increase cessation, and raise awareness of the harms of tobacco use. There are several African countries that have warnings covering at least 60% of the front and 65% of the back of the pack, including Mauritius, Togo, Senegal, Chad, and Cameroon. The graph shows that Kenyan smokers want further improvements in health warnings on cigarettes and smokeless tobacco packages. The red bar indicates that 73% of smokers want more information on the cigarettes, and the blue bar shows that 84% of smokeless users also want more information on smokeless tobacco. Support for more health information was even higher among the respondents who do not use tobacco products. Article 16 of the FCTC requires parties to pass and enforce legislation to ban the sale of single cigarettes. Kenya banned the sale of single cigarettes in the 2007 Tobacco Control Act. All cigarettes are required to be sold in a minimum package of 10 sticks. This ban is important because it intends to reduce access to cigarettes among youth. However, the ITC Kenya survey data shows that there is weak compliance with the ban. In 2018, 82% of smokers reported that they last purchased loose cigarettes. This is the same percentage that was reported in 2012, suggesting that the situation has not improved over 6 years. This means there is easy access to affordable cigarettes, limiting smokers' exposure to pack health warnings, and undermining smokers' efforts to quit by making cigarettes more accessible. Increasing tobacco taxes and prices is known to be one of the most effective measures to reduce tobacco use, particularly among youth. Raising taxes and prices is a win-win strategy. It reduces tobacco use by encouraging quitting and discouraging non-smokers from starting to smoke. And at the same time, it also increases government revenue. The ITC Kenya survey asked respondents whether they think the Kenyan government should increase the tax on cigarettes, smokeless tobacco, and roll your own tobacco. The red bars in the graph show that a substantial percentage of smokers are in favor of tax increases on the products that they use. 60% of smokers favor tax increases on cigarettes, and 63% support tax increases on roll your own tobacco. The blue bars show that smokeless users are also in favor of tax increases on smokeless tobacco, although they have greater support for increases on smoked products. In closing, we would like to express our immense gratitude to all those named in this slide who have greatly contributed to the success of the ITC Kenya project. And now I would like to introduce Dr. Geoffrey Fong, founder and principal investigator of the ITC project, for the concluding presentation of our study findings.
Thank you, Jane. It is a privilege and honor for me to be speaking to you from Canada. I want to thank the Ministry of Health for the opportunity to present the data from the ITC Kenya project. Also, certainly want to thank Anne Kendagor for her fabulous role in coordinating this presentation for World No Tobacco Day, and also want to extend our congratulations to her for being a recipient of the WHO World No Tobacco Day Award. So I'm here to talk about comparisons of the ITC Kenya data with the other ITC countries all throughout the world. It starts with the FCTC, the Framework Convention on Tobacco Control. Kenya was one of the first 40 countries to ratify the FCTC in 2004. And the FCTC has always been an evidence-based treaty. It says so in the foreword. It cares about scientific evidence, and it cares about using it to move the treaty forward. Evaluating FCTC policies provides really critical evidence to support stronger and swifter implementation of the FCTC. The ITC project is a global project, so we have our team here in Kenya, but we also have teams in Zambia, in China, Bhutan, and also we have strong linkages with advocacy groups and international organizations all over the world. The ITC project is a massive global project across 29 countries throughout the world. We created it in 2002, in fact, even before there was an FCTC. We have 29 countries. We are conducting our evaluation work in countries covering over half of the world's population, over 2/3 of the world's tobacco users. We have extensive cohort surveys, repeated surveys, in each country. And one major objective is to evaluate the impact of FCTC policies. In the Kenya National Report, we can compare the results in Kenya to those of many other ITC countries. So I'm going to be presenting key cross-country comparisons of Kenya with those other ITC countries on tobacco use and factors related to smoking, and I'm going to be presenting cross-country data on intentions to quit smoking. Then I'm going to focus on cross-country comparisons of key FCTC policies, including Article 14, cessation, doctor's advice to quit smoking; Article 11, noticing health warnings; Article 6, price as a reason to quit among smokers; Article 8, smoke-free, smoking in bars and pubs; and Article 9, menthol cigarette smoking in Kenya. This is the first cross-country comparison that I'd like to present. It's on intentions to quit smoking in the next 6 months. We ask all smokers in all countries and all waves whether or not they intend or plan to quit smoking within the next 6 months. The figure, like all the figures I'm going to be presenting, is divided into two sections. On the top, the blue bars are those ITC high-income countries, and the red bars at the bottom are the low and middle-income countries, where we ask these questions. So, intentions to quit is the strongest predictor of future quit attempts, so that's why it's important for us to measure. Now, quit intentions are very low in Kenya, and in fact, only 14%, 1 out of 7 Kenyan smokers plan to quit in the next 6 months, which is a much lower percentage than Zambia, 24%, Mauritius, 28%, and most of the other countries in the ITC project. So this is really important because this is a projection into the future of what we would expect for quitting. And the fact that quit intentions are very low in Kenya means that more needs to be done to motivate smokers to quit. Now, the second figure that I'd like to present is advice to quit smoking by a doctor or health professional among those who visited a doctor. And this is relevant to the theme of this year's World No Tobacco Day, which is cessation. We know that advice to quit from a doctor or health professional is a very powerful motivator for quitting. It can really enhance quit attempts in the future and actual quitting. So we want to find out whether smokers are getting advice from their doctor or health professional to quit. Only 33% of Kenyan smokers who had visited a doctor received any kind of advice to quit. And this is quite low. In fact, it's the lowest percentage among 11 of the ITC, all 11 of the ITC low and middle income countries. So this indicates that there is a strong need for doctors and health professionals to be brought in to tobacco control to reduce smoking among those smokers among the patients who are smokers. This cross-country comparison has to do with warning labels. noticing warning labels on cigarette packages often or very often in the last month. This is relevant to FCTC Article 11. Now, Kenya's introduction of pictorial warnings has significantly increased awareness of health warnings, and Jane presented those data longitudinally showing the difference in, or the increase in, awareness of health warnings from 2012 to 2018. These are cross-country comparison. Where does Kenya stand with respect to the other ITC countries? Well, noticing warnings, 76% of Kenyan smokers noticed the warnings often or very often in the last month, which is the third highest among 11 low and middle income countries and higher than all of the high income countries in the ITC project. But Kenyans' warnings are still smaller than the FCTC guideline of 50% of the pack. So an easy way to increase the effectiveness of warnings and their salience is by increasing the size of warnings like they have done in Mauritius, where warnings cover 60% of the front and 70% of the back of the pack. The next cross-country comparison is on price of cigarettes as a reason to think about quitting. This is relevant to FCTC Article 6 on taxation. Now, increasing tobacco prices through raising taxes is the most effective policy to reduce tobacco use. We know that very clearly from the evidence throughout the world. But in Kenya, only 39% of smokers said that price is a reason that they are thinking about quitting. This is very low. It's the fourth lowest of the 11 LMICs in the ITC project. And in fact, it's lower than all of the other countries, the high-income countries, which means that price is just not simply influencing smokers to quit. It's a strong indication that taxes need to be increased so to motivate smokers to quit. Further, taxes should be uniform. All cigarettes should be taxed at the same rate. There shouldn't be any differences in taxation rates of different brands of cigarettes. So there needs to be uniform a tax system in Kenya, which does not currently exist. The next cross-country comparison is related to smoke-free, FCTC Article 8. And this is the percentage of bars and pubs in which there was smoking. There is a strong need to strengthen FCTC smoke-free laws in Kenya, and 73% of smokers reported that the last time they went in bars or a pub, there was smoking in there. It's very high. 73% is the third highest among the 9 LMICs. So there is a strong need to reduce or eliminate smoking in public places, including bars here. Now, next is a cross-country comparison of smokers who smoke menthol cigarettes, and this is relevant to Article 9 of the FCTC Tobacco Product Regulation. Now, Kenyan smokers are significantly more likely to smoke menthol cigarettes than smokers in many other countries. This is really important because we know that menthol cigarettes encourage young people to start smoking and are harder to quit among adult smokers and young smokers as well. 23% of smokers in Kenya, cigarette smokers in Kenya, smoke menthols. And this is it's third highest percentage of the 11 low and middle income countries. There has been a strong movement in the last few years to ban menthol cigarettes. There have been 35 countries that have implemented a menthol ban on cigarettes, and there are several other countries that are adopting or considering a menthol ban there. You can see that there. Canada was one of the countries to ban menthol cigarettes, and so we evaluated the menthol ban in Canada across 7 provinces of Canada in an article that was just published last month. After the menthol ban, we found that menthol smokers were significantly more likely than non-menthol smokers to try to quit. They were more likely to actually quit. And in fact, those menthol smokers who quit before the ban were more likely to stay quit. So there was a significant reduction in relapse of those smokers who actually had quit before the ban. So if we apply the 7.5% greater increase in quitting among menthol smokers, and we apply it to Kenya, here are the implications. We know that from the Global Adult Tobacco Survey, there are 1.7 million smokers in Kenya. From ITC, we know that 23% of those smokers are menthol smokers. So that gives us a total of 391,000 menthol smokers in Kenya. Now, if there's an increase in 7.5% of those 391,000 menthol smokers, this means that if Kenya were to ban menthol cigarettes, and if the effect size was the same as has been found in Canada, there would be an increase of 29,000 smokers in Kenya who would quit because of this ban. So in conclusion, Kenya continues to advance tobacco control despite strong industry interference. An example of this is the pictorial warnings. It's a major advance in FCTC implementation, and Kenya is a model for sub-Saharan Africa and the world. There is a need for stronger implementation of existing policies, however. An example is there is a strong need to ban single cigarettes. There is a need to implement the full set of pictorial warnings on cigarettes and smokeless tobacco. There is a need to increase the size of warnings above 50% of the front and back of the package. There is a need to increase tobacco taxes and to return to a uniform tax structure in which taxes on cigarettes would be consistent across the entire range of cigarettes. Indeed, we find that tobacco users themselves support tax increases. So there really is no barrier, at least among users themselves, to increase taxes sufficiently. We know that physicians and health professionals should be trained to provide advice to quit, a very important aspect to promote cessation. Kenya should consider new policies that reduce appeal and encourage quitting, like plain packaging, which is currently under consideration in Mauritius, and to ban menthol cigarettes. And I've presented some data showing that how it, in Canada, when menthol cigarettes were banned, it led to significant increases in quitting. So I want to thank the Ministry of Health and all our colleagues in Kenya on the ITC project for your wonderful support, and we are very grateful for all of the assistance that you provided. We hope we have been helpful to your efforts in tobacco control, and happy World No Tobacco Day. Thank you very much.